Hi, this video is the art of hair transplant restoration surgery to increase the beard density and recreate the beard, connect the pillar on the goatee and to the mustache. And so this is around 2,000 grafts. It's a low beard. We're using the FUE method. We can do the strip method as well, but the higher beard will take up like 3,000 grafts or more, sometimes 4,000 grafts. Hair transplant for beard restoration is an art form. It requires a lot of the artistic and aesthetic detail to ensure a very natural result. Here's all the many important factors. The facial structure for the beard. When you build the beard, you don't want to do it too high up along the cheekbone. You had to go under the silhouette of it. If you do too high up, it looks, not normal, too rough, like what do you call, like like it doesn't look natural, if you know what I mean. But again, if you follow the natural curve, and follow the flow of the facial structure. But this client, he doesn't want it too high, although he had some hair up here. He wanted the lower beard to have a really nice sharp. And then if we have extra, then we will blend it in with the existing beard on the higher end. So that will give more of a natural blend. He have an option of shave it and clean it up to have a really nice lower beard, or you have an option of leave the whole large beard at a higher level. Again, if you do it too high, it doesn't look normal. It look like what do you call it, the ape man, if you do it too high. Yeah, you don't want to. Some people don't want to do it too low. And once you get the shape down, especially on the sideburn example, once you get the sideburn, you got to follow the diameter of the sideburn and follow the contour of the cheek. Okay, and then on the side where the pillar is, where the mustache is, you can connect it. And again, there's a whole flow to the mustache like this, and it comes down like this. Once we get the shape down, we will try to find a very precise angle, flat against the skin, and follow the whole contour of the face. The important thing is the beard does not grow perpendicular out to the face, and that's very important because I had to fix many of the clients who had it done at some place where they don't have a lot of experience in restoring the beard and have the beard angle coming out like a perpendicular. It's always mostly flat against the skin, follow the contour of the face. Yet, despite the fact that we're trying to do as flat as skin, sometimes the beard just comes straight up. You see how his mustache beard is not flat, but actually comes straight up out. It's just natural sometimes like that. However, our job is to make it more as flat as we can, follow the angle of the face and the skin. And the more flat it is, the more natural it looks. Number two is the selection of hair graft. On the beard, you don't want root to grow 3 or 4 beard. It looks too harsh and it causes dimpling. It doesn't look natural. If you look at the beard hair, mostly in the over 90% or 95% are root to grow single hair. There are root to grow 2 hair. And again, you strategically place on the outer border of a root to grow single hair. Somewhere in the middle, you can put a root to grow 2 hair, but pretty rare, very rare, again, for density. And on the outer border is naturalness, softness, so we put a lot of root to grow single hair. The border, there's no straight. You always do nice zigzag through. And again, the more zigzag it is, the more natural it looks. And again, you can always clean it up by shaving however you want. And again, I give you but here the zigzag through all this stuff. There's no border. Okay, selection of hair graft is important. The angle is important, and the shape overall. And so this is the art of hair transplant restoration surgery for beard restoration. Thank you.